In this video, we are going to show you how to change a transducer on a arterial line. So we've got a radial arterial line here, and this is a two-person technique. If your line is not sutured, if it's got sutures in place, then it's doable just by one person. But in this case, our line is not sutured. So I'm going to start by removing the dressing. And my colleague is going to do everything else.
So just to make the video short and sweet, we have prepared already the sterile fill on a blue tray that has been decontaminated with alcohol wipes. We've got a sterile fill that comes inside the pack, a new dressing, a ChloraPrep squeezed one, sterile gloves that I already put in, a chlorhexidine wipe, some gauze, and some saline. If there is any debris around the area, we will use the saline. Otherwise, we will use the chlorhexidine wipe. We start by putting the sterile fill underneath the connection. My colleague is going to clamp the arterial line. Can you unclamp again?
So we unclamp this way, and we're going to clamp by bringing.
So once it's clamped, means that there will be no arterial blood flow when we disconnect the old transducer set. We can go ahead with that. So you can use the chlorhexidine wipe to undo. You can clean the connection. Remember, 30 seconds cleaning vigorously and allowing 30 seconds to dry. So the new transducer has been already set up in the previous video. And we connect water to water. So it needs to be water to water connection. We achieve that by connecting while we are squeezing the transducer, and that will avoid any bubbles to remain within the arterial cannula. Now, with one hand, hold the arterial line, and with the other hand, just pretend that it's inside the patient. You give a good clean to the side and the surrounding area. Again, allowing it to dry before you put the dressing on. Please refrain from doing this, because if there's any bacteria in the air, you're just pushing that bacteria in there. So allowing it to dry naturally. My colleague takes over. We peel the dressing. Hold it with a finger on top of the arterial line. Just be mindful that it's a lot easier on a patient because it starts sticking straight away, whereas in a mannequin like this, the silicone prevents from sticking, as you can see. And now you're ready to unclamp. Then you can flush the line.